The American people have spoken. They want reform. They want to keep their own insurance and they want change. As your president, I can provide you with everything. I am the president.
How will you bring about such massive change that will really result in reform?
It's simple. We will leverage expertise from best practices. We will look to the pillars of high-quality care in our country. We know that if we can emulate organizations such as the famed Mayo Clinic, we can provide high-quality care at a low cost. We will take the best practices from Massachusetts to California and roll them all up with unique entities called Accountable Care Organization.
What is an Accountable Care Organization?
An ACO is really a miraculous acronym. It stands for Accountable Care Organization, and these will save us money.
When can we start saving all of this money with ACOs?
That is an easy question too. All you need to do is to read the law called the Patient Protection and Affordable Care Act. If you recall, our Congress passed this in March of 2010. All of the details are provided within this act. In fact, it is only 1,900 pages long. It should be fairly clear.
What other things will health reform do?
As I told the American people, health reform is not just one thing, it is a comprehensive change. For example, if you want to keep your own health plan, you can. We will finally be able to provide health insurance for everyone in one of two ways. If you can't afford health insurance and don't have a job, you can be on Medicaid. If you do have a job, we will make your company pay for it. If they won't pay, we will impose fines and penalties upon them to make them compliant.
I have heard that there are problems with this idea. Some states where the insurance company has a small presence, they will run a risk of being unable to comply with some of these rules and that they will leave the state. The people won't have any choice then. I have also heard that many more will have the option of Medicaid. Isn't it true that many providers do not want to take Medicaid because the payments are in most cases below what it costs for them to provide those services? Finally, isn't it true that many of the employers you said would have to provide this coverage are getting out of the business of providing coverage because of your reform?
I think that you may be taking this somewhat out of context. It's true we have offered some waivers to some companies who have stated that it will cause them undue hardship to provide coverage. But still, this is a good deal for the American people.
How many organizations have been granted this waiver?
To date, there have been about 1,300 employers that have been given this waiver, although it represents over 1 million people. Health reform is still good. You will see how great it is. Remember, we have ACOs that will provide us with comprehensive reform.
Isn't it true that many of these ACOs will not really be formed?
No. All you need to do is to look at the pillars of our healthcare system and see how they have already implemented amazing things.
But, isn't the Mayo Clinic in Minnesota a pillar of our health system?
Yes, that's exactly right. That's the kind of healthcare we will provide for everyone. Mayo will be our model moving forward.
Mr. President, did you know that Mayo recently announced that they would not be providing an ACO?
No, I didn't know that. But I'm sure everyone else will think it's a good idea. Listen, the American people have spoken. We need to reform. The bottom line that my plan will be implemented.